Oftentimes, when we are faced with a high body temperature that would normally throw us off balance, most people do not know what to do before setting out for medical intervention in the hospital. Now, today, we're going to be discussing first aid and home remedies for fever. And joining us is Dr. Omadele Boyo, medical director at Pinecrest Specialist Hospital, who specializes in general medical practice. And of course, we're going to be looking at practical ways in dealing with fever. So sometimes it can happen in the middle of the night and while you're getting ready to go to the hospital and all that. So you're just going to show us
just what to do.
Yeah, what to do and where to start.
But maybe I would start by saying that fever is when your body temperature rises above 38 degrees. The normal body temperature is 37, but the truth is you don't have any time that you always have the same body temperature. So the body temperature varies from 35, 36, 37. We don't want your body temperature to go above 37.5. So, but how do you know you have a fever? Most people tend to touch themselves and say, oh, my body's hot, oh, my baby's body is hot. But the key thing here is that if you're going to confirm or you are going to ascertain whether you have a fever or not, you must make use of a thermometer. So a thermometer is the measuring instrument to determine whether you have a fever or not. I have a thermometer here with me, and then because we need to know how to use a thermometer.
I've always wondered because sometimes people put it under your arm, some other times they put it, in different locations.
Now this is what is known as the clinical thermometer. It's used to measure the temperature of the body. Inside this is a mercury. It rises with temperature. So this is the clinical thermometer.
Yeah, so this is the one that you probably encountered.
And it's cheap. Yeah. It's cheap. 200 naira, in some places 100 naira will get you a clinical thermometer. So it's good for every home to have a thermometer. So you don't just say, oh, my baby's body is high, oh, my body temperature is high. The doctor will likely ask you, what was the temperature or what is the temperature? And you can only confirm that with a clinical thermometer. But
so very important, don't work on assumptions.
Yes, don't work on assumptions. But these days, especially after the Ebola story in Nigeria, we went for what is known as the infrared thermometer. Now, people call this a gun thermometer because it looks like a gun.
You pointed at somebody.
As saying freeze, you know. so we now have the infrared thermometer. So we have two types now. The clinical thermometer that uses the mercury,
obviously cheaper.
On my left hand, which is obviously cheaper. They're just like 4,500, 5,000 naira, depending on the make. So this is the gun. They call it a gun thermometer, but the real name is the infrared because it uses an infrared device to measure the temperature.
Obviously, it's also shorter time span for you to get it.
And then you have a minimal contact with the person because with this, you have to ask the person to open his mouth. You can use the clinical thermometer orally, that's through the mouth, as in, So I brought a demo here. Now, if it's a mouth you want to use, you first make sure that the thermometer has gone down because sometimes you may have used it for somebody else. So you do this to it so that the mercury goes down and then you place it under the tongue. If it's a child, you can't get under the tongue, you can place it in the mouth. Don't go too far, just put it like that and tell the chap to close his mouth.
For how long?
Oh no, you can put it there for like, if it's the mouth, the oral one, you can just wait for like a minute and bring it out. Then you now check the temperature. In Nigeria, we use the Celsius, the centigrade. We don't use the Fahrenheit. So most of the thermometers in this country are labeled after the centigrade. And there's many thermometers that have both the centigrade and the Fahrenheit. You know, in Fahrenheit, 98.4 degrees Fahrenheit is normal. But that was since 1973, we've been using the centigrade. Yeah, so we use the centigrade, which is 37 degrees because, and I said earlier, the normal human temperature doesn't have a fixed point. It can vary. Your temperature can be 36 to 37.5 is still okay.
But you should not be above 37.5.
It should not be above 37.5. When it's above 37.5, we say you have a low-grade temperature. When it's above 38 degrees, we say you have a fever. Okay? So 38 and above could be said to be a fever. But 37.8, 37.9 is also low grade. Now, the key thing about fever is knowing what caused it, because the fever is a symptom. The fever in itself is not a disease. So when you have a raised body temperature, you should be very interested in what is causing this thing. Not just, oh, my body is, and most people will tell you, doctor, my body is hot. Have you tested it? That's why we have the thermometer, to
so
do that.
That's the way to start
That's where to start from.
And then the next thing.
So like I said, you have the oral, you can test here.
Yeah.
You can put under the armpit, and in the child, you can put right into the bum.
Okay.
Yes,
okay.
but you don't use the one for the bum and next time you put it in the mouth. So you just know what to do. And some people use the ear. So these are the 4 places: the mouth, the ear, the armpit, and in children the bum. Yeah. So we do that, and then the infrared you
just point it to the person
at the forehead. Basically the forehead, because infrared could be dangerous if you go into the eye. So you point it at the forehead with a distance of like maybe 6 inches or 4 inches, and then you wait for some time and watch it to read. Then you get a temperature.
Right.
So now, after you've ascertained that the child or the adult has a raised temperature, which is above 37.5, then you ask yourself, what do we do next? That's the key thing. The first thing to do is to tell yourself, you're not a doctor, you're just doing a first aid, you're doing a home remedy. So you remove the clothing of the child or the adult, because most people tend to think when you have a raised temperature, you have a fever, in fact, not you think, you feel more comfortable covering yourself up.
Exactly, because
because your body temperature is down.
You could feel feverish.
Yes,
at some point.
Yeah. But feeling feverish, the tendency is to want to cover yourself up. Now, when you cover yourself up, you are preventing your temperature from going down. In the village, even people go near the fireplace, sit near the fireplace, and they want to feel better. Now, that is deceitful. You are feeling better, but you are worsening your situation. So the first thing to do is to remove your clothing, and that can be very uncomfortable because your temperature is up. When you remove your clothing, the chill comes, and you begin to feel cold and to begin to shake. And so, but the key thing here is expose the child, expose the person. That doesn't mean we should totally expose. You could wear light clothing, you could have a singlet on, you could put on the fan as well. And then you may want to do what doctors call the tepid sponging. Tepid means neither not hot nor cold. We talk about room temperature water. We're not talking about ice water, as we call it in Lagos. When something is ice, it's blocked. I don't know why we still say ice water. So we don't need to use cool. We don't need to use cold water. Just you get a normal tap water, and then you take a towel, you place it in the tap water, you wait for some time, it gets wet, thoroughly wet, you squeeze off the water, not too much of it, then you take the towel and you want to put it on the forehead of the person, to bring down the temperature. At times you put it on the chest, and you do that, you press down, not a massage, but you're just putting the towel around the body so that the temperature can come down. At this time, the air conditioner is on, the fan is blowing, and then you are doing this to bring down the temperature. Yeah. But remember,
we're going to have to round off at this point.
Okay.
But all right. Okay. So let's go on now. Now So we ensure that you put it on the forehead and also on the chest.
Yes, just bring down the temperature. And then you could also, as well, make sure the person takes a lot of fluids, because when you have a fever, you lose a lot of water, called dehydration. Right. So you want to make sure the person takes a lot of fluids. You want to make sure if it's a child, you keep him active and be sure that he's talking and making eye contact with you. And then if there are seizures, convulsions, you rush to the hospital. Right. You don't keep somebody with fever in the house. Then you look at other associated things, like is he vomiting, is he having a cough or whatever is going on, is he having rashes. You monitor all those things, and if possible take notes. So when you get to the hospital, you can say my baby was running a temperature of 38.2 or 39 degrees, and that it's also vomiting or throwing up and refused to eat. These other associated factors help the doctor to make a diagnosis.
So it's very important to ensure that, number one, you take a temperature. And then number two, ensure that you try to control the temperature by taking ensure that you're wearing light clothing, or take the shirt off and then put. Some people do a shower, like take a child and put in a shower.
You can go to open the shower on the child and allow the child, although the child will scream because it's different in temperature, will make the child to scream. But beyond that also, you should have some tablets at home. You have syrups or, well, I won't call the brand name, so we call the generic names, paracetamol or aspirin. We don't give aspirin to children below the age of 6 months. Adults can take it, but aspirin has a problem with having tummy pain. So we give the child or the adult 2 tablets of paracetamol, pending when you get to the hospital. But the key thing with fever is that the fever itself is not a disease. The fever is a symptom. It's the reason that you're going to go to the hospital for. Because once you take care of the cause of the fever, you can take care of the fever permanently.
Wow, Dr. Boyer, thank you so much for
All right.
Exposing us
My
to this.
pleasure,
So
my
make sure that you
pleasure.
get a thermometer. It's very cheap, just about 100 or 200 naira to get the
clinical
the
thermometer.
clinical thermometer,
Yes.
and of course the other one is more
Yes,
expensive. But
yes.
have one in your house at least, so that you can check the temperature and know the exact temperature,
Agreed.
and then keep that fever down
Yes.
by
By
doing some of
removing the
these things.
clothes, putting on the fan, and making sure the atmosphere around the person is not hot.
All right, thank you so much,
All
Dr.
right,
Johnny.
great.